Be with us here on Weekend Prime. I am Ashley Mazuri. Our sign language interpreter is Meresha Witi. The country's COVID-19 cases now stand at 191 after 2 more cases were confirmed, one of them a 2-year-old. 2 more people have recovered from the disease, bringing total recoveries in the country to 24. The new figures were announced as a row emerged over how to motivate healthcare workers now dealing with risky situations. The Salaries and Remuneration Commission wants to be consulted over any move to increase allowances for healthcare workers by counties. But the Council of Governors and unions representing healthcare workers want nothing to do with the SRC. Our senior reporter Rita Tidina has details of the latest row.
24 hours after 5 COVID-19 cases were confirmed, 2 more people have tested positive following the testing of close to 500 samples.
1 in Mombasa, 1 in Nairobi. This now brings the total to 191 cases of confirmed cases in the country. And one of these cases is aged 2 years old and the other is 32 years old.
2 more people have recovered from the disease.
Cumulatively, this now brings to 24 the number of Kenyans who have recovered and been discharged from our health facilities.
With testing of those in quarantine, health workers will be the next target group before mass testing is rolled out to the community.
As we try and scale up mass testing, we are bound to get more cases of coronavirus within our population.
With the number of COVID-19 cases set to go up with community testing, a row is brewing over just how to motivate the frontliners in the war against the disease. Machakos Governor Alfred Mutua took the first step, announcing a 5,000 to 20,000 shillings special allowance for health workers, effective 1st of April. But the Salaries and Remuneration Commission is not supporting the move. In a letter to the Council of Governors, SRC Chairperson Lynn Mengich says due process has to be followed in the introduction of any new allowances by way of seeking advisory from the Commission as required by law. To the SRC, in light of scarce resources, it is prudent to use the available resources in the protection of health workers by way of providing the much-needed personal protection equipment. And on this one, the SRC may be fighting a lone battle. The Council of Governors is defending governors who have increased allowances for health workers.
We feel such incentives are key motivators to health workers, who are definitely overwhelmed during this period.
The president of the National Nurses Association has termed as insensitive and provocative the letter by the SRC to the Council of Governors. The Kenya Union of Clinical Officers says the letter by the SRC is insensitive, hypocritical, and an affront against the sacrifices of many health workers who have dedicated themselves under extremely risky conditions. The Kenya Medical Practitioners and Dentists Union wants the SRC to rescind its advisory to the Council of Governors. The Ministry of Health remains non-committal on allowances.
So there are different organizations and government agencies who are reviewing that package of healthcare workers to determine its suitability in enabling them to be able to mass up enough courage and energy to be able to fight this battle.
Conflicts over salaries and allowances are nothing new to the SRC, but with the COVID-19 pandemic, analysts say SRC may have picked a wrong time for a battle with health workers. Rita Tidina, KTN News.
The Big Q in association with Orca Deco.